everyone. Welcome to today's episode of Candid Kaya. Are you interested in one day pursuing a career in the field of public health? Well, stay tuned to hear how Mahogany is applying her Master's of Public Health degree and how Ayana is working to build a substantial career in that field. You don't want to miss it. So, welcome Mahogany and Ayana.
Hi.
Thank you so much for coming on today's episode. Let's start with letting the viewers know just a little bit about yourselves.
Hi, my name is Mahogany Haynes. I'm 26 years old from Bloomington, Indiana. I attended Spelman College. I graduated in 2012. And for my master's degree, I went to the University of Texas School of Public Health, and I focus on health services organization and policy. I'm currently a pre-medical post-baccalaureate student at Agnes Scott College in Decatur, Georgia.
Hello everyone, my name is Ayana Cash Clements. I'm 26 years old and I'm from Harrisburg, Pennsylvania. I graduated from Spelman College in 2012. Since matriculating, I've been working in the field of public health. Currently, I work at Emory Healthcare as a business operation analyst where I specifically focus on process improvement strategies.
So let's get right to it. How do you all define public health?
I think the easiest way to understand public health is when you compare it to the health that people are more aware of. So when you go to see a doctor, it's a one-on-one interaction. So that doctor is focusing specifically on that one patient and the illness that they came in with and giving them a diagnosis. Public health is about studying populations and groups of people, communities, and it's about preventing people from getting illnesses before it happens. So whether it be illnesses or injuries, public health is just about addressing a group's need and addressing it before things happen.
Okay.
I totally agree with Mahogany. I do believe now that it's totally focusing on the health ecosystem, and it's finally getting the traction it deserves because so much of the example she said, it covers everything from the physician to the financial infrastructure to the patient, everything that holistically covers health and how you experience health. Things that we don't even think of. So public health really helps to tackle the issues, but trying to also prevent the issues as well.
So where can we find public health professionals?
Wouldn't you agree you can find them all over the place, Anna?
Definitely. Yes.
You can find them in your local government or on Capitol Hill making legislation such as the Patient Protection and Affordable Care Act, which is known as Obamacare. Lots of people with their NPH helped write the bill, help support it. You can find them as nutritionists, whether that be at your gym because you're trying to, get a six-pack for the summer, or maybe people that have diabetes and they need to know how to get away from certain things with certain foods. You can find them a lot of different places.
Yeah, I agree. You can find them in your schools as community health educators that are focusing on doing research, maybe on like teen pregnancy prevention. You can find them in being epidemiologists doing research on the prevention piece. We talked about which public health really focuses on. You can find them in consulting firms like at the big Deloittes and PwCs because healthcare has a very big footing in consulting. So you can literally find public health everywhere, which is why I love this field.
So Ayana, what are the key parts to understanding public health?
Yeah, good question. To me, public health is really like a moving body, right? So you just think about your own body. You have your legs, your arms, your eyes. Everything works together for your common purpose, which is living day to day. And that's similar to public health. So let's use an example of an issue like teen pregnancy in maybe your local community or even wider, like in your state, or obesity in America. It really starts, one, identifying the root cause, and we're doing research. So you'll have people like epidemiologists and researchers who are really great and knowledgeable and use that information. But what do you do with information? You have to implement it. So then you depend on people who are activists, health advocacy, people who work on behalf of those maybe who are obese and maybe they don't have resources to prevent obesity. So like, how do they get into the community? So you have community activists. You have those who actually make regulations on Capitol Hill, to what Mahogany said earlier, or in your local government structure. So to me, public health really is an ecosystem. You really depend on the expertise of your colleagues. You depend on those who focus on research. You focus on those who focus on implementation, and implementation on a community level, on a government level, and in the workplace.
So So Mahogany, just a few questions for you. Tell us a little bit about why you decided to pursue a master's in public health.
Definitely. So I always knew I wanted to go into the healthcare field, and I'm pretty sure around my junior year, I felt like I was at a fork in the road. I couldn't decide, is it medicine? Is it public health? Is it neither? So once I really started doing more research into the field of public health, and I had experience with different family members having to do a lot of research with healthcare insurance when it came to specific illnesses, what this hospital took versus this hospital, and really learning how to navigate the healthcare system all on their own. And I thought that was very great, but I knew every American doesn't have that type of knowledge or background or resources to be able to figure that out on their own. So I was really inspired to learn more about our healthcare system in America so that I could be an advocate for people that couldn't be an advocate for themselves.
So can you summarize what the ideal Masters of Public Health candidate spends most of their time doing?
Definitely. I feel like Masters of Public Health programs go by extremely fast. It's not like undergrad where you have 4 years, so the first year you're warming up and you have some time. I mean, it's 2 years, so going in with a plan is so important, because by the time you're starting your second year, it's time to be transitioning out. So there are people that work while they're in school. A lot of schools have graduate assistantships where sometimes they can pay for all of your tuition or half of your tuition. Okay. And a lot of times you can be doing research, which is really important because like Ayana said earlier, a lot of public health is driven by scientific research. So learning how to do those skills underneath a professor, someone who's experienced in the field. So a lot of people work. And on summers, I think that it's best to probably do an internship, and that's what most of my colleagues did. That's what I did. So I think studying, research, and internships are probably the main 3 things that MPH students are doing.
So now that you have a Master's of Public Health, what can you do with that?
Wow. There's so many things you can do with an MPH. I think you can work directly in the field. So you can do a fellowship with any type of company, whether that be a federal fellowship, or there's lots of nonprofit organizations that are looking for MPH graduates to really get their feet wet. But you can do things in an untraditional route too. So there's people who go to law school and they have a JD MPH. There's people in medical school, dental school. You can apply it to so many different things. So it's a creative degree, and I think if you know what you want to do with it, that's the best tool, because you can use it to your advantage.
Okay. So Ayana, now I have just a couple of questions for you. So you mentioned earlier that you concentrated in public health while you were at Spelman. So do you have to have a background in public health to work in that field?
Good question. To me, from a personal opinion, I don't think you need an actual public health background depending on what role you want to do.
Okay.
So for instance, if you want to be more focused on epidemiology or like a nutritionist, I do think you need to be probably well skilled in that field and have done some kind of like study in that since it does have a lot of pieces like research based.
Okay.
But if you want to do things like health education, if you want to do things from a policy perspective, if you want to do things from a hospital workforce perspective, I don't think you necessarily need a public health background.
So we learned from Mahogany that she has a master's in public health, and you're working in the field of public health. So tell us how you gained employment without having the extra master's degree in that field.
Yes. So to all of those out there who are looking for career change, listen to this. No, but in terms of having a master's, it is a very great helpful tool. However, I did not have one. And from my experience, I was able to break through into the public health sphere, specifically in the workforce, by first volunteering. Understanding exactly what did I want to do in healthcare. And I think because healthcare is ever evolving and changing, I'm still learning that today. So you never really get complacent, which is a good thing. But I also said internships. There was every year of my collegiate career, actually, I did an internship. My first year, following freshman year, I actually interned with the Pennsylvania state government, focusing specifically on their public health department. My sophomore year, I did a fellowship at the UNC School of Public Health. My junior year, I actually did some communication analysis and focus with Planned Parenthood of Maryland. And then my senior year, I was kind of venturing into health law, thinking I wanted to do that. I'm clearly not doing that now. But I actually did a fellowship with the Atlanta Legal Aid, specifically focusing on their health law department. So overall, if you're really trying to kind of gain that experience, I think going into it, they want to make sure you're devoted to the field, especially depending on what kind of role you want to do. So I can think without having a master's, I was able to kind of break into that. Because like anyone will know, graduating from school, just because you have a degree does not mean you may find a job.
Right.
So having as much volunteer experience, having as much internship experience really helped me to land my first role out of school. And my first role was being a special programs coordinator for a nonprofit organization specifically focusing on women's health. And so it was really good, very engaging, but I was able to do that, I believe, really from experience and knowing exactly kind of where in healthcare I wanted to be.
Okay. So do public health professionals only work to address national health issues?
Actually, no. That's the great thing about this community is that we focus on so many things. Actually, public health, there is a niche called global health. There is a concentration or focus. So say if you've got a master's in public health, you can focus on that, or you can actually just pursue workforce as well. And the global health has a very good imprint on the world. So for instance, if you're looking at Peace Corps, there's a part of Peace Corps specifically focused on, maybe you're focused on malaria, focusing on HIV and AIDS, kind of tackling those health issues. Something also is called USAID Global Health Fellows, where you can be placed all over the world focusing on specifically on research. So public health really is a great way of tackling things on a national perspective as well globally.
So I want to get some advice from the both of you. Mahogany, what advice do you have for students who are preparing for an MPH program?
I definitely say get very familiar with the website sofast.org. That is where you're going to apply to any public health school with one application. So get familiar with that. It's definitely a doable process, but it can be tedious. So start early, ask for letters of recommendation early, and really research the schools you're applying to make sure it's a good fit for you and the lifestyle that you want, and network. I think those are the best 3 things you can do.
Okay. And Ayana, some advice from you. So what advice do you have for those who are interested in pursuing a career in public health, but are not able to find a job or the right job just yet?
I also agree with Mahogany. Network as much as you can. There are public health professional groups, probably in more metropolitan cities, but I would say get involved. Really hear what's going on still, so you be really abreast of all the issues. So when you go into an interview, they say, wow, you're really good. You really know what's going on in the field. Also, volunteering. Networking again, but volunteering specifically to network. So don't just volunteer, but specifically say, okay, like how can I meet the vice president, or how can I meet maybe the human resource officer. So volunteering specifically to network, as well as to kind of gain some more experience. So that way when you go into different interviews, or you're also applying to different jobs, that you will really find like, you have some passion behind what you're really trying to do.
So how do you both see the future of public health?
I see the future of public health making our society a healthier and safer place to live. So I see people dying less from certain diseases, and really being able to be knowledgeable of what's going on in their community, all from public health being implemented in their lives.
I see innovation. I see a field that is going to be moving towards technology, and I see a field that's going to continue to expand research to tackle any new health issues in the coming future.
So there you have it. Thank you so much, Mahogany and Ayana, for joining today's episode of Candid Kaya. We hope that you all learned so much today about public health. And if you guys have any questions for either one of them, just comment below and we'll make sure that they get answered. Thank you all for watching, and we'll see you next time.
Bye!